Good Monday afternoon, everyone, and thank you for joining us on our media update for today. I'm joined by Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. And if you don't know already, but yesterday we announced the exciting news about our mobile vaccination clinic that began bringing the COVID-19 vaccine to residents at long-term care and high-risk retirement homes in Hamilton. So over and above the staff that many of whom have already been vaccinated, we are now going to be doing all of the long-term care residents, 37 homes, in fact, altogether, some 4,900 residents, all to be done over the next 7 days. So very great news, and certainly a great innovative approach from our public health. And congratulations to them all for making this happen. It's great progress. And even though we're seeing very high case numbers, it is now more than ever important to stay vigilant and continue to follow the guidelines and restrictions set out by the province. So even though the vaccine's on the horizon, doesn't mean that we shouldn't stay home as much as possible or limit our outdoor activities, limit our activities to outside, to essential activities only, and wear the mask as much as possible, wash your hands, keep your distance from one another, and if you have any COVID-19 symptoms or are not feeling well, stay isolated at home and get tested. These recommendations are not going to change for quite some time, whether you have the vaccine or not, until such time as we're 100% either vaccinated to the degree that we need to be, and that we have confirmation that the additional spread has been minimized or eliminated. Our public health teams will keep working around the clock to ensure that everyone ultimately gets the vaccine. But in the meantime, it is not available to everyone just yet. And so we're prioritizing on the long-term care home staff and residents where we've seen the highest degree of incidence. So please be patient. We're all going to get it at some point. It'll be prioritized based on need. Trust the experts and continue to follow all of those important recommendations that I just talked to you about a few minutes ago. It is going to be challenging times for sure. And as things get more difficult, ever more we need to be vigilant on those recommendations so that we can at the same time vaccinate and at the same time reduce the spread of this virus in our community. I'm going to turn it over to Dr. Elizabeth Richardson so she can tell us a little bit more about the vaccination and the good work that's happened over the weekend or started over the weekend and how we're going to proceed from there. Dr. Richardson.
Thanks so much, Mr. Mayor. It has indeed been a very exciting couple of days here in Hamilton as our vaccination clinics got underway, expanding into the long-term care homes and high-risk retirement homes. I'll come back to the vaccine in just 1 second. I'll start off as I usually do, though, and give you some of the case numbers. So we're at 7,474 cases today in Hamilton. That's 155 new cases from yesterday. And as you've heard me say, we were sitting, about a month and a half ago at about 40 cases per 100,000 population per week. We went up to 80 to 100, and then we've been sitting now at about 150, 160 new cases for the last couple of weeks. So a fair degree of transmission that is still going on in our community. Our effective is sitting up at 1.16. For everybody to remind ourselves, what that means is as long as that number is over 1, this is going to keep growing in terms of this pandemic here in Hamilton and the outbreaks that are occurring here. So still very concerning in terms of what is happening despite our good news. We have had 202 deaths to date, 2 new deaths reported today, and we're currently reporting a total of 38 local outbreaks on our website. No new ones were added today, though several were over the weekend. And of course, there's a lot more information about COVID-19 activity on our website. So back to the vaccine. Yesterday, we began the clinics using the Pfizer vaccine. So what happened was that the province had been working hard to figure out how the Pfizer vaccine, which is quite fragile, how it could be moved from the place where it would arrive. So it comes into the province and then comes to the initial depot here, and then could we move it on to another site to give it to people? And they figured out with the pharmacists and experts that it could be done as of Wednesday. And so we worked hard to get clinics up and running this weekend, and we're able to do that as of Sunday. So we will go into 37 homes. Those are 27 long-term care homes and 10 high-risk retirement homes. And those risks are defined by the province. And so they're homes where they have 4 beds in some of their rooms and similar things like that. And we'll be vaccinating about 4,900 residents across those long-term care homes and high-risk retirement homes, including those that are currently in outbreak. So there were concerns initially that we wouldn't be able to work with homes that were in outbreak for many reasons, but with working through some of those and talking to our colleagues who were the initial pilot clinics in Toronto and Ottawa and York and Windsor, we realized that we would be able to go ahead and vaccinate in the homes that are in outbreak. At the same time, the Hamilton Health Sciences fixed site clinic does continue to operate and is going to be focusing on administering second doses as well, because we've now reached the stage where people can start to receive their second dose from those that were first vaccinated back on December 23rd. So far, we've administered across the HHS fixed site about 5,700 vaccines to long-term care and retirement home workers, essential caregivers, and some other healthcare staff. We've also immunized about 150 people yesterday at the mobile clinic. So everybody's asking a lot about when is Moderna going to arrive, and we are very much wondering the same. We continue to get assurances from the province that we can expect it soon, and so we're just waiting for finalized, notices that it is actually here, and then we'll be able to begin administering the Moderna vaccine. It is a little bit easier. It's not quite so finicky in terms of administering it, and so that will make the clinics easier to run as well. In the meantime, we'll continue to administer the Pfizer vaccine, and as long as we have supplies to do that. We do continue to meet several times a day with our provincial colleagues, with our colleagues here in Hamilton. Again, we have the Hamilton COVID-19 response table that is working and has a vaccine task force as part of this this work, and are looking at taking the provincial frameworks that are out there. The province has provided prioritization frameworks and ethical frameworks, and continues to give more prescriptive advice and direction as we go forward about what they're expecting us to do and specific targets and timelines that we're expected to meet. And so our group is working on sequencing who comes next in terms of receiving the vaccine. I want to again put a shout out about our vaccines website, because it's a very good website. And as we talked about today on the Board of Health call, it's very important to go to trusted sources of information so that you can get the accurate scientific information you need in order to make decisions and understand how this rollout is happening. And so that's www.hamilton.ca/COVID vaccines with an S. And that's going to continually be updated and evolve as we get more information. So please take a look at it and keep going back to it and taking to see if there's been any changes and what new is there. So I do have to say, with all that optimism, I will still remind you, as the mayor did in his opening remarks, that it is very important that we don't lose sight of the fact that we are still seeing a high number of cases and a high number of outbreaks. And these are continuing to give significant pressure to our long-term care homes. We have very limited health human resources. And so across those long-term care homes, congregate settings, our hospitals are seeing high rates of COVID admissions and COVID patients in the ICUs. And we know our system is operating as one whole system across Ontario when it comes to those hospitalizations and ICU patients. And so, the pressures that are happening in other areas around us are affecting us as well. So we all need to work together to keep this under control, to get this under more control, get that R effective or RT or RE, whichever version of it you're looking at, get that down under 1. So that we can continue to preserve capacity. If you've been vaccinated, you do still need to follow public health measures. We don't yet know if the vaccine prevents transmission of the virus. So we don't know if you could still get infected and pass it along to somebody else, although we do know that it reduces the likelihood that you'll get sick if you do have the virus. So we need to know that as well. And that's why public health measures remain very important for everyone as we move forward. So we are going to need to hang on a little longer. We know we'll have limited supplies of vaccine right now. We'll have more people who want it and more people who have a very good case for wanting it right now than we have vaccine. So we're going to continue to sequence that out in accord with the provincial frameworks and ask everybody to hang on until we get into the spring spring and into the summer when it will become more plentiful. And again, we're looking at the vaccine being available for the general population in the last part of this year. So with that, I'll turn it over to Paul.
Thanks very much, Dr. Richardson, and absolutely a good news story about not only the work that's been done at the fixed site vaccination program run by Hamilton Health Sciences, 12 hours a day, 7 days a week, all that great work, but now getting out and vaccinating residents within long-term care and retirement home. And I said this to somebody today, that as I received the updates by email and by text, you could feel the emotion even through something that's as static as email and text. I think there is a sense now that we are finding our way through what will be a number of months worth of work in terms of vaccinating our population, but you need to start at those beginnings, and we have, and it's going well. So congratulations to all those involved. We continue at the EOC to monitor and enforce what is still a lockdown. And this lockdown continues for quite some time here in the province of Ontario, and of course, has been extended to include the additional closures of schools for longer periods of time. And so this is a really critical time where adhering to the rules and conforming to the lockdown measures is critically important. But along the way, we do need to recreate, we do need to be active, we do need to do things that that appropriately get us out of our homes and get us at least off our rear ends every once in a while. And so I'm pleased to announce today that in recreation, we do have a number of new activities that are going to help people do that in a few different ways. We do have some self-directed activities, story walks, winter disc golf, some snowshoe lending and Nordic pole lending that's going to happen in a number of locations. Reservations are required for those activities. We have a limited number of take-home kits that can help families do some things in their own home. These were very popular in the summer, and we've revised that and brought that forward again here in the winter. And recreation has a lot of virtual programming as well for both older adults and for the younger members of our community as well, and for everybody in between. And so lots of online things to do with trivia, virtual puzzles and games. But our Senior Center Without Walls virtual program is one that I want to remind our community is available. Critically important right now that we reach out to those who are isolated, and older adults who are isolated may be at particular risk. And so our Senior Centers Without Walls, we would love to see our senior centers up and thriving with all the people they normally have in them. Of course, that can't happen at the moment. And so to do this virtually is a way of bringing some of that great senior center work out into the community in a virtual way. And for younger people, we're going to have virtual scavenger hunts and things like that. So all of these are available by going to our hamilton.ca/winter webpage, where you can see all of the activities, which also include the things that have already started, including the access to our outdoor rinks. They are open for a long number of hours. We open these at 8 in the morning. The last people are off the ice about 10:30 in the evening as they go through that final reservation block later in the evening. So there's lots of opportunity for people to reserve and get time on our outdoor rinks, or to try and show up and see if there's some empty slots and join the limited numbers that are there. One thing we have found, and we've had to take some action, is that people were using these outside of those hours. In fact, at 11 o'clock, midnight, 2 in the morning, causing some concern for the neighborhoods. We have deployed some security to those locations. And just a reminder, you are not to be on that ice surface when it's not open. So between that 8 a.m. and about 10:30, 11 o'clock at night, when we have staff there, that's when people can be on. Outside of those hours, it's not allowed. And if our bylaw officers or police are attending to those calls, you may pick up a fine for using it out of hours. So please stay off it. Many of these rinks are in residential areas. And so the noise and the carrying on that can happen outside of those hours disturbs people trying to get their rest. But the other side of it is, with no one there to control it, the numbers can get out of control. We had up to 70 people on one of our outdoor rinks until we had to send some folks to disperse that group. So we want to make sure people are enjoying all these great opportunities in a safe way. You may have noticed that the province of Ontario has extended emergency childcare and extended the eligibility for emergency childcare. Just a reminder that childcare for those who are infants through to 4 years old has never been closed. It continues to operate for families who need that. The emergency childcare is there for children that may need access to spaces where they can do their online learning. They are in full-time schooling, but ensure that children in the elementary school age band can find spaces to do their online learning and have proper supervision and support as well. The best thing to do is to go to the hamilton.ca website. If you go to hamilton.ca/childcare, you'll get all the information, including contacts for where you can get in touch with folks to see whether you are eligible and just to get some basic understanding of what you may need. Obviously, we're trying to respond as best we can to the expanded list of eligibility that came out over the weekend, and make sure that if people need it, that it's there for them. Currently, there's not a wait list for it, so there are opportunities for people to access that childcare if they're eligible and if they need so. So I encourage people to go on those websites. From an enforcement perspective, we continue to enforce, continue to issue charges under a variety of acts and categories of things that we can as an enforcement regime take ownership of. And I just draw your attention to the ones business-wise that have been added to the list. You'll see that a number of them are for not having a COVID-19 safety plan. And some people may say, boy, you're getting pretty bureaucratic with that. But just let me remind you what's in that safety plan. That safety plan is how those businesses plan to operate so that they have all of the proper PPE in place, all of the proper controls for customers that are coming in, what they're doing in terms of what happens if there are cases within their business. So these are not simply one-pagers that give very little information and maybe seem to be a bit more bureaucratic in nature. These are the plans that ensure that the employees and know what's happening within the workplace and can do the right things. And that way, those who are able to access those facilities or come to those facilities are also protected as well. So safety plans are as important as complying to the number of people that are in a business, to the active screening that's happening. And remember again that there's very few businesses that are open. These are essential businesses. We do not want to have these become places of large outbreaks or places that aren't safe at all. So encourage business to maintain those safety plans and have them readily available should that be necessary. So encourage everyone to continue to be vigilant with all of those measures that the mayor and Dr. Richardson talked about. And we are recognizing that the province is saying there may be some more measures coming in the next day or so. And as those get released by the province and announced by the province, we will add those to our enforcement regime as well. Mr. Mayor, back to you.
Thank you, Paul, and thank you all for your added information this morning. Very important that we continue to share accurate information with our community. And let me take this opportunity to assure Hamiltonians that this vaccine is safe and it's effective. Many millions of people have already had this vaccine. And so you can rest assured that it's been tested thoroughly by Health Canada. It hasn't missed any steps in terms of the speed at which it was done. It was done as thoroughly as any other vaccine would have been done, and it's totally safe for you to take. And it's our best solution ultimately to overcome this pandemic. Having said that, we're still in a lockdown. And Paul reinforced that, as did the doctor. We're in a lockdown for a reason, and that reason is to stop the spread of this virus. And unfortunately, right now, the vaccine is not the solution to stopping the spread at this moment. That still is in your hands to avoid contact with folks that are not in your household, minimize the amount of contact you have with others outside of your home. These are still the measures that are going to help stop the spread. I was a little disheartened to hear that some polling was done that indicated that possibly 50% of our population decided not to isolate over Christmas. Maybe that is why we're seeing such dramatic increases in the cases. It is not too late to turn that around. And so change that behavior, get back to self-isolating yourselves, maintaining that physical distancing and masking as much as possible. And if we do that, we can limit the spread of this virus and start putting more attention on the ability for us to get these vaccines into arms. Hopefully look for a better day going forward. So stay with it. Keep following the advice of our public health officials, and if we continue to do that, we should be good. By the way, there are many myths and misinformations about this virus out there. There is no messing of DNA with this virus, and that's certainly explained in some of the information we have on the website. It doesn't have a microchip in it that collects data and tracks who you are and where you've been. None of that is true. That's some of the conspiracy theories that are out there. So get accurate information, and you can do that in the City of Hamilton's website, where they bust a lot of the myths that are surrounding this vaccine, and the Ontario Ministry of Health and Health Canada websites, both of which provide reliable information on the vaccine and how it can help overcome this pandemic. On that, I will turn it over to Jasmine for questions from the media that have attended this morning, or this afternoon, I should say. Jasmine?
Great, thank you, Mr. Mayor. We have 6 media on the line today. We'll start with 1 question and 1 follow-up for everybody. First question to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi there, thanks for taking my question. My first question was, Public Health recently issued some new orders to St. Elizabeth's, Villa Italia, and Blackdar. Can Public Health provide any more details about why those orders were issued and why there's still shortfalls happening in care homes in Hamilton in terms of infection prevention?
Hi, Fallon. So in terms of those, I don't have the specific details around those homes or around those orders. We have no problem releasing those orders. They are considered public documents. If you would care to get receipt of them, I'm sure Jack could help you with those. Essentially what the orders do, though, is they're a result of our investigations into outbreaks. When we look at how things are being handled there, they cover the issues primarily related to infection prevention and control. So if we're seeing that there's any challenges in terms of PPE use or environmental cleaning, if there's any of those sorts of things, then they would end up being ordered to follow all of the suite of measures that are really essential for outbreak control. So the specifics we'd be able to follow up with you on. Unfortunately, the reality is that several of our premises continue to have challenges when it comes to infection prevention and control. Some of that is due to the challenges with health human resources that they are just extraordinarily tight. And, we have a number of hospital partners that are supporting retirement homes and long-term care homes in the community. And the home and community care and agencies are supporting them as well. But we're, with the number of outbreaks that are going on there and the challenges when it comes to overall health human resources, there just is a significant challenge across. And that's why it's so very important that we get these numbers down. The outbreaks that happen in long-term care and retirement homes very much reflect what's going on in the community. So if we get our numbers down, we can get the numbers of those outbreaks down. We're hopeful too that the vaccination programs will make a difference.
Can I ask a follow-up question?
Yes, please go ahead.
Okay. And then my follow-up was also for Dr. Richardson. Can you vaccinate people who have COVID-19?
Yeah, so that's a great question, Fallon. So the way they're rolling out the vaccine right now is they are vaccinating anybody who has previously had COVID, while we still understand exactly what happens with immunity. And so it's fine to go ahead and vaccinate people who have had COVID-19. And they will even vaccinate those that are asymptomatic recent positives. It's only if somebody's really quite ill with COVID-19 that we wouldn't go ahead and vaccinate them. And that's the same thing we do for every vaccine. If somebody's really quite sick, we don't recommend any vaccine be given at that point in time, but it be delayed and considered a little bit later once they've recovered.
Great, thanks, Dr. Richardson. Next question to Maria from the Hamilton Spectator. Maria, you can go ahead. And we'll just get you off mute there, Maria.
Hi, sorry, it took some time. I wanted to ask about, so several senior homes are using agencies to bolster staffing during outbreaks. And I was wondering if Dr. Richardson could explain the public health regulations for those workers. Like, for example, I understand that they are the exception to the rule that workers can only work in one home, and that there were also recent changes to how often they were tested. So could you speak to that, and also how often they were required to be tested before and now?
Thanks very much, Maria. I don't actually have the specifics around that subset of the workers. So if at all possible, Jack will get back to you with some details on that.
Okay, sounds good. And so then I'll just ask you my follow-up question. So we had a story on the weekend about a family member who told us that their loved one at Shalom Village was showing symptoms for more than a week before staff began using PPE. And that person later tested positive and unfortunately died. And the family member was concerned about the transmission that had occurred in the interim. So I was wondering if you could comment on that and how these gaps continue to exist.
Thanks very much, Maria. I'm not aware of the specifics that happened in that. That would be our outbreak team that is handling those outbreaks, and we wouldn't comment on the specifics related to any case in any case. But I just do want to say that when it comes to detecting these cases, it is really important, as you're pointing out, that they be detected early and tested early. Some of the challenges they face, though, in long-term care homes are, again, the piece about older people may not exhibit signs that are very specific for COVID-19, and so it takes very careful watch and sometimes takes a little bit of time to see that there is something different that has changed. It may just be a slight change in behavior. It may just be that they're not eating and drinking as well as they would have been. So they can be subtle in this particular patient population, but I don't know the specifics in terms of what happened at Shalom Village.
Thanks, Dr. Richardson. Next question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My question's for Dr. Richardson. I'm wondering, with the COVID vaccine, if you're able to tell us how many doses of Pfizer we've received to date and when we're getting the next shipment and how many we're expecting, because by my math, we've received, or last time we were given an update, we had 6,000 doses of Pfizer, but from your numbers, it sounds like we would only have about 150 left as of today. So I'm just wondering if we've received more and what you can tell me about that.
Sure, Katrina. I'm afraid I don't have any update from what Jack sent to you this afternoon, which is the province has asked us not to speak to the specific allocation amounts and exactly those numbers. And so I can tell you we continue to receive volumes as we go forward. If they want to be the ones that speak to the volumes and where they're going, they're the ones who know that, where they're planned to go from moving forward as they're trying to allocate according to need across the province. So we do continue to have a supply. I can share that with you. We're continuing to run the clinics, but we're very much planning on a very short-term basis, day by day, week by week, as we go forward and as the vaccine gets allocated by the province.
Okay, thank you. And in terms, there are currently 9 outbreaks that are associated with hospitals in Hamilton. And I'm just wondering if you can speak to this, how concerning this is for public health.
Thanks. Yeah, there too, Katrina, absolutely concerning for us. All of these outbreaks that we're seeing in healthcare settings and long-term care in hospitals, they really reflect what is going on in the community. And as long as we continue to have high rates of cases in our community, we're going to continue to have outbreaks in our healthcare settings, in our long-term care homes, in our hospitals. And you're quite correct. These are very concerning. We know we have pressure on the hospitals because of the number of COVID cases we have and the number of people who are needing to be in hospital and need ICU care. We have pressures on our hospitals because they're the ones that are supporting long-term care, retirement homes. We also have pressure because they end up in outbreaks themselves as they go forward. So, all of those things are concerning, and this is why, as I said, we need to get those numbers down so we can save lives and preserve capacity in our health system to save not only those who have COVID-19, but all the others that need treatment for cancer, heart disease, and the many other things that are out there.
Thanks, Dr. Richardson. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions today. Dr. Richardson, my first question is for you. You talked to the Board of Health about purchasing additional data in terms of projections and I think mobility. Can you talk about that and what it showed?
Yeah, so we're just exploring this right now to try and get some more modeling potentially for us. And of course, we're not wanting to duplicate what might be done by others, and the province is doing it at the provincial level, but we're just exploring. You'll know that we did a fair amount of this in conjunction with one of our resident physicians who had a particular interest in modeling. And so he was working with some of the the other physicians around how we could model going forward. And we did that when we had him on board with us. But since we haven't had him with us, we've been looking at other ways we might get that information. And so we're working right now with a group that does that kind of modeling, seeing if it's something that we should invest in. Of course, being very mindful from a financial perspective, whether it's something we need to invest in locally or whether that's something we can get elsewhere. So we're just in the process of exploring it and understanding what they can do for us.
And my follow-up question, I'm not sure if this would be for Mayor Fred Eisenberger or for you again, Dr. Richardson, is at Board of Health, you referred to that data showing levels of mobility, high levels of mobility in Hamilton. And then the mayor seemed to reference a poll that showed 50% did not isolate over Christmas. Like, can you talk about these two things and where you're getting them from and what they showed?
Yeah, so this mobility data is something that's been used by the province to look at how people are moving around the province. And so it's using just some information that comes from cell phone data to look at how people are moving. And what we know from the province overall is that people are moving more than they would, than they really should if you were following the guidance that is out there. And in some of the things that we've been talking about with these modelers about what they can produce, they did show us some early results which showed that Hamilton is on the higher end of that group as well in terms of the movement. I can't speak for the mayor in terms of the particular survey, Mr. Mayor, that you were looking at.
And you know what? I remember reading it and hearing about it, or maybe I heard it on the news, and I just put it into my my comments just now. I don't know if it's true. I really don't know the source, to be honest with you, but it was certainly something I heard on the airwaves over the weekend.
Great, thank you, Mr. Mayor. We'll move on to the next question from Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone's having a great day. My first question, maybe this is for Dr. Elizabeth Richardson. Is there any particular reason why we don't have on the COVID-19 website the number of people who have been vaccinated? There is a real public interest to know just how many had the vaccine in Hamilton. And I know I'd love to write a headline that says, this many people have been vaccinated so far.
And Bobby, I'd like to have the dashboard that tells me that every morning too, now that we've got it going and rolling. So we're just working out these dashboards. Part of the challenge is that you've got the province wanting to do and we want to do and each provider wants to do it. And so we're sorting out what's the best dashboard to have. We're very much encouraging the province to do one that we can all then use because that's the most efficient way to get it done. But meantime, we'll continue to tell you, give you updates in terms of the number of people vaccinated as we go forward.
Thank you very much. And my follow-up question is, I see here that based on the GTHA mayors and chairs, you're happy that there's not going to be a curfew. You're hoping that the government sort out who should backstop workers who lose a paycheck from testing positive. But is there anything that the city is planning on doing specifically to bolster the lockdown? Because I know that right now, I guess we don't know anything about this mobility data here, but if people are moving around and they're not caring, is there not more that we can be doing? Is there anything that we're considering?
I'm going to turn it over to Dr. Elizabeth initially. The same question was asked earlier today at the public health meeting, and I'm happy to address the issue of sick pay, which has been an ongoing issue. And one of the, we've been advocating for this to the both provincial and federal governments for quite some time. And it is a big step in terms of them dealing with some of the outbreaks that are happening in industry. And, we are aware that, far too often people cannot afford to take a day off and go into work sick. And that is certainly not conducive to stopping the spread of this virus. And so if the government can backstop the sick pay, and some folks are talking about 10 days, I'm not sure what the number ought to be, but it ought to compensate people that are sick, that if they take a day or 2 or 3 off to get tested and get cleared up, that they get compensated for that. So that's the genesis of that. Beyond that, I'm going to turn it over to Dr. Richardson in terms of anything else that we can do beyond not having a curfew.
Yeah, so when we look at these issues, thanks Bobby for raising it, it is quite concerning. We know that people are still in some cases choosing not to follow public health measures. They're going ahead and seeing people from outside the household. They're going ahead and not wearing masks. They may be going to work sick. Now, sometimes that is a choice. Sometimes it is, unfortunately, because there is some stigma that has become associated with COVID-19. And so they know that people will know that they didn't follow the rules if they didn't go forward, or they may think that they may perceive it as people getting in trouble if other people are identified as having been, who they were with, they were sick, or who's going to need to now go into quarantine because they've been exposed. And so, there is unfortunately that factor coming into play to some extent. And then, a fair bit of it too is these structural issues that the mayor has talked about from a policy perspective, in terms of people not having sick days. They don't have a choice but to go to multiple employers in order to make enough money. And there's structural issues that are certainly driving some of this as well. And so I would say when we look at our data, it is those same issues. We've known about those issues for months and months now, and we've put in place a number of things locally in order to address specific concerns here, done some of them in advance of the provincial government at times. But really now I think it's time to wait and see what the Premier is thinking of in terms of where we go from here, and we expect to hear that in the next day or two from the province, and then and look at what more there might be that can be done. But I do expect from everything the Premier said that he's looking at some strong measures.
Thank you.
Thanks, Dr. Richardson. Next to Justin from CBC Hamilton. Justin, you can go ahead.
Yeah, hi there. Thanks for taking my question. My first one's pretty simple. I'm just curious as to why, and this could be for the mayor or for Dr. Richardson, why you don't believe a curfew would be effective, or why you would not be on board with such a measure.
Well, I think jury's still out on that one. I think the province will decide one way or the other what measures they think are appropriate. I don't have any evidence that suggests that curfews have been effective in other places. That may very well exist. I don't know. But I think in many respects it's kind of a last draconian step. I mean, there's not much more that you can do beyond that. So if you go down that road, that is really the last thing that you can do to try and restrict people's movements. And so we've been working on an approach that lets people know why it's important for them to self-isolate and physically distance and all of those things. If we hadn't have done that, the caseloads would have been dramatically higher. And so we've had success of keeping it at a minimum. But, the Thanksgiving and Christmas and Boxing Day and New Year's made it particularly challenging. And I fully understand that. But a curfew would very much be a kind of a last final step that you could do to actually have an impact. And that certainly would be, I think, in some respects, from my perspective, draconian, and something you might want to hold on in reserve until such time as you see that other measures are not taking any positive effect. So I would say, something to keep in the quiver, but not something that we should be triggering right now.
Okay. So follow up, I mean, fair enough. Just to kind of go off of that point, though, in terms of it being a last resort, we are hearing that, the ICUs in Ontario might be full by February and overflowing. So I'm just wondering what else maybe you would be considering, or, how far do we go before something like that is thought about actually being implemented?
Again, I don't have an answer to that. I don't have access to the data that the province has, and maybe the doctor has some information on that. But there aren't too many measures left to deal with. We'll see what the province decides tomorrow. I believe the Premier is going to advise of additional measures that hopefully will have an impact. And then, depending on what that impact is, additional measures could be considered. I know that Quebec is right now in curfew mode. with some consternation, I believe, but and you know what, no assessment yet as to whether it's provided additional benefits or results. So we'll leave it in the hands of the province at this point. They've got the data. We'll see what they decide tomorrow, and we'll go from there.
Great. Thank you very much, Mr. Mayor. That's the end of our media questions for today. So I'll pass things back to you for some closing remarks.
Great. Thank you. And thank you, media, for those questions. All important issues that we need to stay informed on and hopefully make decisions on going forward. So thank you. And thank you to Bill Custers and the entire team at Cable 14, as well as at Clear Cable, all of whom have made these availabilities so smooth and successful. And to all of our residents out there, please stay home as much as you can beyond getting out for essentials, which is, you know, work or groceries or the kinds of things that you need to have to sustain your everyday life. But at the same time, the only way that we're going to reduce and eliminate the spread of this virus is to stay apart as much as we can. As difficult as it is, as much as we all want the vaccine yesterday, these are still the measures that are going to be effective. And hopefully the more of this we can do, the more successful we'll be, the more we can start to focus on vaccinations and hopefully down the road get to some sense of normality. Do get accurate information, as I mentioned earlier. Go to our hamilton.ca/coronavirus website. Information about helps and supports for businesses and individuals in our community, and information around the virus and the vaccine. All of that is available on the website. Get accurate information. Social media isn't the best source of information for a lot of this. It is best to go right to the source, which is credible sources from Public Health, Health Ontario, and Health Canada. All of them have information on their websites that you should be able to rely on. Our next media briefing will be on January the 18th at 3 p.m. and we look forward to seeing you then. Thank you.